Ever wondered how your body maintains a dynamic, steady blood pressure despite countless variables that throw it off balance? The answer lies within the body's own internal control system, the baroreflex response. Our story begins with the baroreceptors. The baroreceptors are found primarily in the carotid sinuses, located at the bifurcation of the common carotid artery, close to the internal carotid artery, and in the aortic arch where they constantly monitor blood pressure. When they detect a change in blood pressure, whether it's an increase or a decrease, they fire off electrical signals. The frequency of these signals is directly proportional to the blood pressure. A higher blood pressure stretches the arterial walls, resulting in more signals. Next, we move on to the integrating center. This is where the signals from the baroreceptors are received and processed. The brain, specifically the medulla oblongata, interprets the frequency of the signals from the baroreceptors. If the blood pressure is too high, the frequency will be high and the brain will engage the parasympathetic nervous system to lower the blood pressure. If the frequency is low, the sympathetic nervous system is activated. Finally, we arrive at the effectors, the body structures that will change. In response to signals from the brain, the heart and blood vessels are the effectors. If the blood pressure is too high, the parasympathetic nervous system is engaged, slowing down the heart rate and dilating the blood vessels. If the blood pressure is too low, the sympathetic nervous system is activated, increasing the heart rate, the force of contraction, and constricting the blood vessels. To summarize, the baroreflex response is a three-step process. First, the baroreceptors detect changes in blood pressure. Then, the brain interprets these changes and sends messages to the effectors. Finally, the heart and blood vessels adjust their behavior accordingly to bring the blood pressure back to normal. The baroreflex response is truly a crucial negative feedback homeostatic mechanism, maintaining a dynamic blood pressure equilibrium.